Hi everyone, my name is Ipe. I'm a first year medical student at the University of Toronto.
And I'm Arthi. I'm a first year physician assistant student, also at the University of Toronto. And this video we're going to be covering the non-academic aspect of each of our programs. And we
As first year students.
As first year students during first semester at least so far. So yeah, do you want to get started?
So we're going to break this up into like structured versus non-structured non-academic activities. So in terms of the structural aspect of it, as I mentioned in the last video, an academic part of our curriculum includes clinical skills, so learning to actually take patient history and perform physical examination and other maneuvers is important. And so we have that, we have that on Fridays, and we can either examine real patients, and so this includes going out on the ward and kind of interviewing patients who are sick. So some are sicker than others, and we get to take their vital signs or perform physical exams on the patient as well. And while it is important for our learning purposes, we're really not contributing at all to their care. So the patients do volunteer for this, and it's more so us getting to work through the process of what happens on the ground. And other times we have standardized patients, which is really just actors or actresses that volunteer the time. They do get paid, I guess. But they come in and they're patient X or Y, and they're presenting with a particular symptoms, and we just learn how to take history and kind of come up with a differential in our head. But at this point, because we are just first semester, well, this is a reflection on my first semester, so we were just first semester, first year medical students at the time, so it wasn't our responsibility to come up with a diagnosis for the patient. It was just really getting us to practice taking comprehensive patient history. What about you?
So ours is, again, like, since it's accelerated, we do play somewhat of a role in our patient care. So ours is LCEs. So with clinical skills aspect, we do see standardized patients, and it's more they are actors and actresses, and it doesn't seem as real, but it helps you kind of get used to the routine of doing the medical history, the different components of medical history, and then coming up with differential diagnosis, and then also practicing your physical examination skills. Again, it is super accelerated, so like you'll be taught how to do a cardiovascular exam today, and then tomorrow morning you're going to see an SPE or two on that. So like it is very like, okay, you're going to learn something overnight. And the good thing about it is with standardized patients is that you have the opportunity to make mistakes. It's like a safe space, and we get feedback from the SPs, and they're like, when you did this, I felt comfortable, or when you did this, I felt like
that's exactly
abandoned.
What they say.
Yeah. So sometimes it does get very, very personal, and that's good because like it's actually like a real human kind of telling you about their experience and how they felt about you, so you can kind of take that and like change the way you approach the situations. But then with my LCEs, or longitudinal clinical experiences, where I'm responsible for kind of setting up different placements, and last semester I did it in ER, family practice, I did an EMS ride out with the paramedics, I did the coroner's office. I think that was pretty much it, but at the ER and family practice with the family doctor, I was able to kind of play a role in, or I like to say, in patient care, in that I was able to build a good relationship with both preceptors, and I went in and saw the patient, took a medical history, and then I reported back to the preceptor, and then they kind of, like, you know, ask you different probing questions, and they're like, okay, did you get information about this? So you gotta make sure it's thorough, and then when you go back and report it, you also have to know what the next step is. So you'll be like, I wanna do this for physical exam, and then after that you go back and you report the findings, and then they sometimes do come with you, or sometimes they do the test alongside with you to make sure, like, you know, it's the same findings, and then you come up with differential diagnosis. So one thing I remember my family practice preceptor was saying was, you walk in with 10 differential diagnoses and you walk out with 3, because you're trying to rule these different things out, and make sure you pay attention to red flags, and include the more severe or important, I guess, like cases, so that are differential diagnosis, so that you're able to rule those out with your findings. So yes, it's more hands-on, but it's also kind of nerve-wracking, but it's also a good experience because next year we're actually going to start our clinical rotations. So it's good to apply what you learn in class kind of while seeing patients.
Our pace is definitely a lot slower because we don't really need to participate in patient care till clerkship. Right now we are in pre-clerks, and so clerkship will be happening in about a year and a half or so. And so we have a lot, like our journey is slower and getting to that point. But I mean, similar, same thing, but different.
Yeah, I guess it depends. Like, it's kind of like when they want us to kind of go in and like get our hands-on experience, but the preceptor is still confirming it. So like we're not entirely responsible for patient care, but it's just nice to kind of have that autonomy from the start, so that you're able to build that confidence in a year's time versus like 2 years, right?
Yeah.
But yeah, I guess that's like and you also do something at Sunnybrook, right?
Yeah, so this is actually what we do at Sunnybrook. We have our clinical.
But then there's like other shadowing.
Yeah, so but that's a lot more self-directed, because I think yours is more kind of, you need to have these placements. You set it up yourselves.
But we do have requirements.
Yeah,
so it's like 10 hours has to be family practice or ER, so like primary care, and then the rest you have flexibility. But
yeah, and you have a shorter time course to complete that, whereas for us, we have the opportunity to shadow different doctors, so we just go about looking for those physicians ourselves, so you can meet them. They can be a lecturer that taught you a lecture in blood or immunology, or they can be your CBL facilitator. It really doesn't matter, but we do have to complete 36 hours in the course of 4 years, so that's
a lot of time.
Yeah, that's a lot of time to do like 36 hours. Yeah, and I'm pretty sure like I've done that already, so like it's really self-directed, and you get to choose like, oh, you're interested. It's really about exploring the different options and figuring out where your interests lie, because you will eventually have to choose which specialization that you want to go into. So ours is more self-directed, I would say. The last part of our structured part of our non-academic is our IPE sessions, and IPE stands for interprofessional education. And so the basis of this is that, you know, healthcare is a team-based sport, or a team-based profession. Yeah. And so, as you know, you have your dentists, you have your nurses, you have your physician assistants, you have your physicians. You have so many people that play a role in the patient of one single patient in a lot of the cases. So IPE is U of T's attempt to get us to understand how to get us to learn how to work with each other before we actually have to work with each other. And I actually really enjoy it. And there are two components to it. There are compulsory courses that you automatically enroll into. They kind of send you an email, you've been enrolled in this, and so it's like, okay, cool. But there are also electives that you can take, and that's when you can have a little bit of flexibility and freedom in choosing what you want to learn about. For me, I've done one IPE session on HIV stigma, and I really enjoyed it. We also had a big, huge IPE session, which was at in September?
Beginning of October. So I remember it was after my first residential block, and I thought that was really cool.
Yeah, it was nice.
I think what was it, 13 different programs?
Programs within the healthcare, like professional.
Like professional, yeah. And it was that convocation hall was like huge, a lot of students, and we were also, there was a lot of students, but they also grouped us up into multiple mini groups where everyone had, like I was the only PA in my group, and then there's a pharmacist, there was a nurse, there was a physiotherapist, dentist, like, so that everyone, when they give you these cases to work on, everyone has different input.
I only had one other person in our group, but...
Oh, did you? You only had 2 people?
It's just me and her, yeah.
Oh.
But she was a speech pathologist, so she was different.
So that's still different. So like, it's interesting to know how everyone contributes to patient care, and how it kind of helps you think in a way where you're like, this is this person's strength, so I should ask this person about this, and this is like my strength, and I should be more like knowledgeable about this. So it like helps you kind of understand how the collaborative aspect, which is a CanMed role, buzzword again, how the collaborative aspect of healthcare, and to kind of educate you about that, I guess. And so speaking of electives, so I guess with mandatory ones, there were 2 that were scheduled in first semester. I think that's it for us for at least first year. Yeah. For at least the PA program, I'm not sure about the MD program, but elective wise, you have the flexibility to choose, and there are a lot of options, but at least for the PA program second year, we're doing clinical rotations, and there's 5 months up north and 5 months down south, and it's going to be a more hectic schedule, so I try to get more electives done in first year, and like one of them I'm scheduled in for is exercise prescription, so I thought that kind of related to my kin background and how I can apply it to my profession as a PA through actually like using exercise prescription. But I also did one on death and dying last semester, and I thought it was very interesting in that it is an important aspect of healthcare, and it's something that helps you reflect on how you kind of process death and dying, and then how you can help other patients and families process it and how there are different factors involved in that. So it's definitely not just like there's the collaborative aspect of it with the different professions, but it also helps you kind of explore different topics in healthcare as well, based on your interest.
Yeah. I should probably get on
to the non-structured.
No, I should probably like get better at like scheduling my IP electives, because once clerkship hits, which is a year and a half from now, like there will be basically no time to do that. Yeah. So I gotta make a reminder, right? So med school is not all just about academic aspect, as we touched on, and it's not just about structured non-academic events as well, or activities. You also have the freedom and choice to spend your free time as little as you can squeeze out. Doing things that actually interest you. And the Medical Society at U of T is cool because they actually have a bunch of different interest groups. So they don't call them clubs, they call them interest groups, and they can be specialization specific, such as the pediatric interest group or the emergency interest groups, and or they're like less structured, not less structured ones, but less intense ones, I'd say, such as dance group, or like mental health or mindfulness. Mental health is important, or like mindfulness, or like outdoors. I don't know if that's, I'm making that up. Anyways, so there are different interest groups, and I think the only interest group that I'm actually committed to, despite all the other ones that I gave my information to earlier in the semester, is the Black Medical Student Association at U of T. And so that's something that I enjoy learning from others about and contributing to in some capacity. What about you guys?
So we don't have anything structured like that, but non-structured, non-academic activities are vital for any students, despite it being MD program or PA program, because without that work-life balance, you're going to definitely, most likely, burn out, and mental health is important. So you got to make sure you have time to balance out these other stuff. So like, other than the interest groups, which we don't really have, I make time to, like, you know, squeeze in a workout, which we did together a few times. Like there's just other stuff you can do. So like reading, like try to read for pleasure instead of like, you know, Bates. It's hard. It's kind of triggering because you're like, the last time I read it was like Bates, the textbook or something. But or like even meeting up with friends. Like we did that a couple of times last semester. We went out for dinner, and most of the time, yes, you're like venting, but it's good to have someone else who's also venting and listening to you actually. And like it's just good to have that kind of outlet, whatever it is for you. Some people in our class do yoga. Some people go to dance. Some people just go do group sessions, like fitness classes. Like there's so many different options. Just like there are so many different options for structured, non-academic, and academic stuff. So like, find what works for you and definitely make time for it, because that is very important as a student in both the PA program and the MD program. Yeah, definitely. And like running is definitely an outlet for me. I find that I can just kind of like, with each stride, a little bit of my stress gets like suffocated. That's really graphic imagery. Sorry, but I actually recently found that one of the, gyms at our school, so Hard House, actually has a lot of free group classes, and I went to Zumba yesterday. It was a workout. It was fun. I feel like a fool when I'm dancing and like the steps. 3 steps behind. But it was really nice and it's fun, and I think that I'm gonna try and make a better effort at balancing those, like the work-life balance, work-life health balance. And also a big aspect for me is faith, and so I go to church on Sundays. Didn't really go last semester because a lot of our assessments were usually on Mondays, and so I got to figure that out. But having an anchor that kind of helps you stay grounded during hard times, and part of that is the friendships that you make through these programs. And so I find that having friends in med school who understand what's happening and what's going on, like you're better able to relate with them, and that was something that I found really helpful for me. And I've definitely met such amazing people along the way, and I still have this one, so that's great. But the difficult aspect of my transition though was because I was at UBC and I just moved into the city, which meant making new friends, and so it was really important for me to try and keep in touch with my old friends and to make sure that I still had them as a support system, even though it's now in a different capacity. Yeah, no, that's definitely very important. I was going to add something. I'm trying to think of it. Oh yeah, definitely. At least for our program, it's only 28 of us, or it's like a smaller group. So everyone's very close with each other, and it's important that you reach out to people who are going through the same thing as you, because they might have like techniques, or they might have already like solidified their concepts, so they can teach you stuff. And like it's like you're almost studying, but also relying on your social circle, I guess.
Social capital.
Okay, that is very true. That's from MCAT. So yes, so that as well as family. So sometimes I would just call my mom and like talk for an hour and like
rant
and vent and like it's like, yes, it's good to have someone in your program, but like usually they're trying to fix things, us being like type A personality people, or like, but like you can try this, you can do this, I get it, like, you know, but I understood this, so like this, and like sometimes it's just good to have someone who's like just listening, and like a mother does that really well. So definitely like acknowledge it and talk about it and reach out to people. Everyone has their own like social circle, and like try to distract yourself.
For me, that was my sister, actually.
Okay, yeah.
Yeah, because like I was fortunate enough to live with my sister, and so it was really nice to just kind of come home and like rant and vent to her, and she wouldn't really look at me differently. So it's really nice. I'm so grateful that I had her as a support system, especially because I was so removed from my social network back in Vancouver. So like that was really nice for me, and also I got to go home more frequently than I would have if I had gone to UBC. And like having my mom. Oh yes, last semester I cooked all of once. Like I did not cook a meal for myself. Like my mom literally cooked a bulk of food, and my dad would drive it all the way down to Toronto. So that's been a huge helpful aspect of it.
And we're spoiled that way.
Yeah, so now I'm just like, so now we just got back from Christmas break.
And isn't it amazing that like the food you get is like the best food, like the best dishes, so they don't like, you know, not the regular dishes, the best dishes, so you're just like, it's your incentive when you're studying. I just look forward to lunch and dinner. I don't know about you, but
same. Anyways, I think that we're gonna stop talking, and that wraps up our third video in the series. If you're still here, thank you for being patient with us. But honestly, we're doing this because I definitely feel like I would have loved for someone to kind of provide some insight into what life is like in med school, and I find that there are not a lot of profiles out there that does that, and so this is kind of like
Canada,
for Canada, and this is kind of our attempt. I hope it's a good one. I kind of like putting that information out there for all the prospective students who are going down either path.
Yeah, we hope it helps, and again, if you have any questions, definitely message us, or if you want us to talk about different other topics, definitely let us know and we'll try our best.
Stay tuned. Bye.